Good morning and welcome to your clinical day. Today is February 12th, and I'm going over what you're going to do today in clinical. So, our focus today is going to be on gestational diabetes, on preeclampsia, and hyperemesis gravidarum. So, the first thing you're going to do is we're going to be together for about the first hour, half hour till about 7:15, and we're going to practice S-bar. So we'll kind of take turns going around the room and having everyone chime in on an S-bar. So we'll just kind of listen and give feedback. Then we are going to get your assignment. You'll get that in your email and you'll get started. You're going to work independently until 1:30, and then we'll meet back at 1:30 for post-conference. And then myself or the other clinical instructors are only a text or an email away at any time. So the first thing you're going to do when you're on your own is you're going to do 3 learning templates, one for gestational diabetes, one for preeclampsia, and one for hyperemesis gravidarum. And you're going to upload those into Canvas, into the clinical shell for February 12th. Then you're going to go on to ATI and you're going to do real life maternal newborn 3.0. You want to complete the scenario for gestational diabetes, and I have the directions there. And then you're going to do a scenario for preeclampsia, and then I have the directions there as well. The last thing you're going to do is a video case study, and you're going to do priority setting, and I have the directions, and I'm going to take you through all of this. And then you are going to, on a Word document, you're going to answer these 3 questions. If you were the nurse in the situation, which client should you see first? Identify the priority framework you're using and the rationale. Take notes, describe your strengths and weaknesses of your submission based on your review of the expert answer, and then write an S-bar report based on your patient in the real life maternal newborn with gestational diabetes and upload that. And then for debriefing, we're going to talk about some aha moments. So I want you to answer these questions, submit it into Canvas, and we'll go over this in post-conference. So describe an aha or something new you learned during the module. Give an example of how your clinical practice will change from this module. Describe how you would handle the situation if the pregnant patient had a history of opioid use disorder when you were assessing her, and give an example of each for resources needed for the pregnant woman, including nutrition, prenatal appointments, immunization, and safety in the home. All right, let me go into ATI. I hope that you can see that. All right, so you're going to go into My ATI, Real Life RN Maternal Newborn. So you're going to go into My ATI, Real Life RN Maternal Newborn 3.0. And then you're going to complete the scenario for gestational diabetes and preeclampsia. And there's your scenario, there's your people. I want you to make sure you see your electronic medical record up here. Follow that through. And then you're going to listen to the scenario.
Okay, now that we've
And then answer the questions. And then you're going to do the same thing for preeclampsia. So you're going to go into preeclampsia. And then you're going to go into video case studies RN 2.0 priority setting. Bear with me here. Hope I'm not getting you dizzy. And there we go. Okay, so you're going to do priority settings right here. And then you're going to answer those questions I talked about. You're going to write an SBAR report based on your patient in the real life maternal newborn, and then answer those questions, those debriefing questions, and then submit that into Canvas. And then we're going to talk about that at post conference. All right. Thank you.